You know, in The Matrix, there's that moment where Neo stops seeing the chaos and starts seeing the code. Well, most of us look at healthcare data and it looks like chaos because, frankly, it is. Right now, healthcare isn't short on data, it is overwhelmed by it. It's messy, it's inconsistent, and it's incredibly hard to interpret. But what if we could actually see it clearly? What if we could organise it, understand it, and turn it into real evidence? That's what today's guest is doing. He has built software that takes messy, fragmented clinical data and makes it readable, usable, and ultimately useful. In other words, he's helping healthcare see the matrix. Hello and welcome to Pulse Amplify, where we sit down with the leaders and changemakers shaping the future of health. Proudly brought to you by Pulse IT News. I'm your host, Louise Shaper.
And I'm your other host, George Margellis.
Today we've got a good one, George. We are joined by Guy Tsafnat, an entrepreneur turned academic turned entrepreneur who has spent years working at the sharp edge of healthcare data, interoperability, and AI. Guy is the founder and chief scientific officer of Evidently, a digital health startup focused on making messy, real-world clinical data actually usable inside health systems. He's published extensively in health informatics and AI and is well known for challenging hype, particularly when it comes to interoperability and the promise of unlocking healthcare data, and probably some AI hype in there as well. Guy, you're our first entrepreneur and founder on the pod to share the lessons you learn only by building. Plus, we are going to delve into how to get more value out of the data healthcare already has and what we should be doing to take advantage of these new AI tools. So, Guy, thank you so much for coming on the show. Welcome to the Pulse Pod studio.
Thanks for having me. Great to be here.
Very pleased you could join us, Guy. So, Guy, my understanding is you came over to Australia after a successful exit overseas to take advantage of our sunshine and wonderful quality of life we have over here, and somehow or other ended up into academia. Tell us a little bit about that journey and how your entrepreneur to academic to entrepreneur journey has evolved over time.
Sure. So I went to university at the heart of Silicon Valley in San Jose, California, and finished my degree as soon as I could to get out to the job market because there was so much money to be had. This is late 90s. The dot-com was in full swing. Drifted into cybersecurity, which was a very lucrative market, still is. So even when the dot-com crash came, cybersecurity was very protected from that. I was not enjoying cybersecurity. There's nothing wrong with it. It's just not my cup of tea. At the same time, there was a presentation, a curriculum series in my university where they brought engineers at the end of their career to come and talk to the new fresh graduates, engineers, to talk to them about careers. And there was a particular one by a guy called Don Shiley, who spent 45 years at NASA building diaphragms and valves for spacecraft. He spent about 5 minutes on that in his presentation. And unfortunately, it was triggered by his wife getting very ill, but him switching and saying, I can actually manufacture these valves for hearts. These are the same valves that I make for NASA. I can actually replace defective valves in people's hearts. And he spent 50 minutes on the journey of the last 5 years that he had at the time. And as far as I remember, they had something like 120,000 implantations. They have more than that now, of course, probably millions, I would say. But I found that story very inspiring, and I knew that I can apply my skills with AI in healthcare. And so when I moved to Australia and I, enjoyed the sunshine, but got really bored with only sunshine. And
oh, yeah. Oh, everyone in the Northern Hemisphere right now has got the violin out for you, Guy.
Yeah, well, that's right. I like chocolate cake, but you can't just have chocolate cake. So I didn't want to get a job. So I went to the University of New South Wales, got a PhD there. I joined Enrico Coiera in his center. I used the opportunity to switch into healthcare, and I really enjoyed that decision. I wouldn't say I was a particularly good academic. I was always interested in impact, less so than publications. Publish a paper, show that it works, that's great, but then take it to the market and bring it to the people so people can actually benefit from this. So in 2018, I had a stern conversation with Enrico. He was very frank with me and very honest. and told me that I was performing worse than a junior freshly minted postdoc. And I said, look, I'll try harder, really focus again. I know I can do it. But I thought about it for the next 24 hours, and I came back to him 24 hours later, and I said, you know what, when I said I want to continue to work hard, it actually meant that I don't want to do that. What I want to do is to go back to industry and start a company. And at that time, evidently it was my 10th company. There was one other company that came out of my lab before that. So I wrapped up my lab and launched it as a company, brought with me a few of the people that worked for me at the lab, and I haven't looked back.
Wow. I didn't realize, Guy, we've known each other for a while. I didn't realize evidently it was your 10th startup.
Yeah, it's actually 10 out of 11. There's a newer one as well.
Oh, there's another one. Okay, we'll have to have you back on the show. Okay, teaser for next time. Yeah, that's impressive. Does it get easier, this entrepreneurial startup? Because it's just complete chaos. I love it, but a lot of people don't. But you keep coming back for more. You're on to number 11. So does it get any easier? What motivates you? What keeps driving you?
I think I just don't learn. That's the... It is exciting. It is chaotic. It is complex. I actually like complexity. This is what drew me to healthcare data in the first place. I actually really like complex things that really bend your mind. I enjoy the chaos. Sleep can wait. There'll be plenty of sleep time in the grave. And so I'm giving up on that for now. But yeah, it's more than that. I think there is a lot of stress, a lot of pressure, financial pressure as well. It doesn't matter how much money you have when you start a company, you're taking a vow of poverty again. You put everything you have behind it. I had 3 children at the time. It wasn't an easy decision to leave a paying job to not only stop getting paid for the first year and a half, but also paying other people's salaries out of my own savings until we started raising money. I can't say that it was easy, but you want to do in life. Money is just money. It'll come and it'll go. The meaningful things, you do what you like. I think they say, if you do what you like, you don't work a day in your life. I think, well, you do what you like and you work every day of your life, but you'll enjoy it at least. So it is a life choice. You can't think of it as a project. Does it get easier? I would say every company I had was different from the previous. They're different products, different people, different circumstance. Every journey is very unique to solve how to message your product so that the right people understand what it is that you're adding to them. That's a different problem for every product.
And obviously you've had this experience across multiple countries. And other than our sunshine, which is obviously one of our great benefits, what's uniquely good and uniquely not so good about starting a global healthcare startup here in Australia?
I think Australian startups are at a big disadvantage compared to other places in the world. One of the issues that is maybe quite cliche, but it's still true, that there is no appetite for innovation. In Australia, there's much more fear of failure than there is anticipation of success. And people are much more afraid of being the one who bet on the losing horse than to think about, wouldn't it be great if we had this? And that is a big disadvantage for Australia, because other startups that come to Australia from other countries will have already proven themselves in their home countries, where you don't need to spend a lot of money on travel to the other side of the world to meet with a client. You can have local clients that test and prove your technology with. And then they come to Australia and they have a proven product and everybody's walking them in and yeah, sure, I'll buy a product. And there's no risk for me, right? I'll just buy a product. There's no risk for me. Whereas when we go out to the world, to other countries, we have to prove ourselves for the first time. We have to spend a lot of money on travel. Even with Zoom, you do tend to travel a lot, and that's very costly and time consuming. And those are big deals. You don't meet the customers. You might not have the same culture as your customer because they're in a different country. You might not have a lot to connect over because they don't watch cricket in whatever country you're in. And so these are where the disadvantages are. There are advantages in Australia as well, which are the development costs here are a fraction of what they are in the US. We tend to spend something like 32 to 38 cents to the dollar on development without compromising quality, but just because we're in Australia. And there's two reasons for that. One is just the differences in cost of living. Yeah, I know Sydney is expensive, but it's nothing compared to San Francisco. That's one thing. So we could maybe pay salaries that are dollar for dollar the same. So that's already 40% less when the dollar is 60 cents. The other one is we do have a good grant system in Australia that is not competitive for companies. The R&D rebate is a huge driver for success in Australia. So those are advantages we shouldn't be sliding, but it's still, on the whole, I would say it's probably easier to start a company in the US, even when your expenses are much higher, because sales are so much easier.
And what would you say are one of the lessons you've learned as a technical founder?
One of the lessons learned early, especially coming as a technical founder, the technical stuff is so much easier than the sales. And that is something you learn. You know, it's not to say that it's easy, but to sit in front of your computer at your own time and solve problems, I think maybe not for everyone, but certainly for people who do this well, this is really easy. But then to go out to the world and to explain to people why you've done what you've done and how do you think it'll help them, and to listen to them and to really test yourself. Is this helping them? Is it not helping? Is it really adding value? These are much harder questions to answer. They're much more subjective, and there's no real criteria for success. You can't run a test to see that your messaging works. It's having 10 to 15 meetings and working with different people with different backgrounds and communicating effectively with all of them. It's quite hard, right? It's much, much harder than, I think, writing code. Yes, with my background, it could be different for other people.
There's more within your control and your abilities, whereas when you're out there in the world, you can do your best, but a lot of it is just shoe leather, isn't it?
Yeah, that's right.
Given that this is a team effort, I know in tech world, everyone's waiting for the $1 billion startup that's only got one founder in it. But anyway, we're not quite there yet. So this requires a team. And I'd love to get you to pass on your advice, Guy, because I spend a lot of time with people at the beginning of their startup journeys and they realize they can't do it alone. Sometimes they're technical, but often they're also clinical and they actually are looking for a technical person. So I often get asked how they should go about finding a co-founder or co-founders. So how did you tackle this? Let's say with Evidently, or if you have a general answer, across 11. So how do you tackle this? And what advice would you give other founders?
Yeah, you're right. The sort of thing that is a little bit different in every company, but also there's a lot of common themes around there. I think the advice I would give people is there are people whose sole job it is to help companies, and you can start there. There might be angel investors, there might be VCs, there might be accelerators. It's how you have the conversation with them. If you meet with an angel and say, I need $50,000, you're not going to get very far. You might get paid, but you're not going to get very far either way in terms of help. If you go to an angel investor and say, look, I need help to do this. These are the areas I need help with. I don't want your money. I want or maybe I want your money too, but I want your help. That's a much more constructive way to approach this. It's just ask for help. That angel can recommend maybe you should join hands and take your idea with their expertise and put it together. If you ask for help, you will get a lot of help. So there's a lot of focus on fundraising early days, a lot of focus on pitch decks. I think these are way overrated. What's underrated is conversations, asking for help, and really being open to changing your mind about what it is that you need. So you might come in with an idea, I need a salesperson, but somebody who knows the area or knows the commercial side of your area might say, yeah, you do need a salesperson, but before you have a salesperson, you need someone else. You need a COO, let's say. Or if you're not technical, you need a CTO first. You need to have a product before you can sell it. Be open to that and listen to them. They typically don't say that because they have some ulterior motives. Typically, that's their true assessment. Now, it doesn't say they're wrong. Do critically think about those answers, but be open to them as well. So be open to changing your mind. Whatever you think your startup is going to do on the day that you launch, I can promise you it could do anything, but not that.
Oh, that is such good advice. I love it. Well, time for a quick break. And when we return, Guy is going to be explaining to us just why healthcare data is so messy and so broken, and what we can do to easily clean up our data in healthcare so we can make really good use of it and use it to generate the evidence to drive our decision making. We will also get Guy's take on where AI currently is at and where it's going. So, Guy, you have said that healthcare is data rich but evidence poor. That's a great line, by the way. So, can you explain that and maybe paint us a picture? Like, just how broken do you think healthcare data is?
Yeah, that's a good question. Thank you. I think healthcare data is been patched up over the years. And if you know the history of health records over the years, then you understand why it is the way it is. To understand one record, you have to focus just on that record because there's no background information that can tell you how to understand, how to interpret it.
So that contextual piece about your patient or about what is done before, what's worked well before. Is that what you mean?
Exactly, yeah. So if you're, say, a new clinician in a new hospital, you have to learn a new electronic healthcare system, even if it's the same vendor, even if it's the same version, even if it's the same institution. If it's a different electronic health record system, it looks different. And the way it looks at the user interface affects what they look like on the back end as well in the database. And so if you're looking at the records, the same records from the database side, it's exactly the same miss and the same irregularities that are occurring. I want to be very clear that the system is the way it is, and it's not anybody's fault. It's all kinds of combination of environmental and legal and human. It's intersection of all those things that have brought it to the way it is. I'll maybe use an analogy of just how bad it is. I want you to imagine that you're at home and you're inviting an electrician to add a light in the living room. And the electrician comes in and says, that's not a problem. That's what I do. I can install that in 2 minutes. But I'm going to have to spend the first 9 months studying your home, understanding exactly who comes and goes. What do you want to do with the light? How does the physics of electricity work in your house? Because it's different to every other house. And that's pretty much the situation. You have vendors who come in and bringing systems that need to use the data that's in these healthcare provider systems. And they have to spend months, sometimes up to 2 years, just understanding the data before they can actually add value to the system. And a lot of things can happen in 2 years. And so a lot of these projects fall over earlier than that. A lot of costs just pile up. And by the time you get it, it's maybe not even relevant, or you paid for this thing and you now don't need it. I would really like to see that change at least.
Well, why is it like that, though, from your experience? Is it because the very nature of healthcare is like these wicked complex problems? Because there are other industries that have wicked complex problems that,
right,
don't spend 9 months, like you said, studying how electricity works in your house.
So this is where healthcare is different to other industries. Other industries, you'll find that the problems are much more repeating. And in healthcare, they're much less. What I mean by that, if you look at the organizational pyramid, let's say a new imaginary bank has the model. You have the CEO at the top that makes all the decisions. And then everybody below that implements the decision, maybe make decisions about how to implement those decisions, but it keeps trickling down to the point where the teller at the bank that you see, they don't really have much options on what they can do. So there's one source and that's at the top and it trickles down. In healthcare, it's the other way around. There's the CEO of the hospital, maybe the minister of health, and they can make policy decisions. But at the end of the day, the decision makers are at the coalface. They're the clinicians who actually see the patients and actually decide what to do. So they might get guidance and they might get some advice on how to do it from people who came before, their superiors. But at the end of the day, their decisions are what matters. And that gives us a huge variety of problems that don't exist in other industries. And you can see this. If you go to a hospital CEO and you ask them, what's your top 3 problems? And you go to another healthcare CEO and ask them, what's your top 3 problems? You'll get completely different problems from each of them. Whereas if you were in a bank and you said, what's your top 3? At least 2 of them would overlap between different banks. And so this is really where healthcare is different. You can't go and solve healthcare. Healthcare is millions of small problems that are quite complex. They're small in the sense that there's a few individuals interested in each problem, but that doesn't mean that those problems are not important or that they're somehow insignificant. They're all significant. They all help in care. And because of that, it compounds with complexity as people's problems are being solved, not in synchronous, and they create new problems. new interactions between them. And so that's where the complexity of healthcare comes from.
Okay. And then so what's the linkage then between that complexity and your original statement about healthcare having all of this data, but not having the evidence?
Right. We have a big repository of data, every hospital. There's various estimations about how much of the world data is actually healthcare data, but it's anywhere between 20 to 30% of the world's data is healthcare, and how much of that is actually getting used is around 5 to say 20%. And so we have a lot of data and we can't access it. We can't get into it, can't make sense of it. And that's why we're rich with the data, but the evidence, which is the insights that come from the data, they're not there.
Back in the 20th century, when I was a young doctor, the concept of evidence-based medicine was the mantra. We use the information we have to make evidence-based decisions. I think what you're saying is that even though we have access to that data, we're actually not using that data to make good decisions based on evidence? Or is it just we don't have the tools to do that yet?
Both those statements are correct, right? We do have the data, we don't have the insights, and we don't have the tools as well to create those insights. There is an aspiration to be more evidence-based. Going back to the origin of Evidently, the research I was doing at academia was around why is AI not being used in healthcare? But clinicians are trained and they already know how to use evidence, and the evidence-based medicine was working. And so the conclusion of the research is that if we had an AI that generates evidence as opposed to an AI that tells the doctor what to do, again, going back to the decision maker being the doctor or any clinician, an AI that generates evidence was perceived, at least at the time, to be the solution that will generate all the evidence the clinician can then not just use, but also know how to use and have the tools to use and have them in their decision-making process. Since then, one of the things that we've seen is that healthcare is way too complex for that, and we can't just generate evidence. And so the approach we've taken with Evidently is actually to let our customers generate their own evidence rather than generate it for them or to tell them what evidence they need to generate. We just say, here are the tools. They're accessible. They make the data accessible. And you can run it on your data and see what the evidence says for you.
So how do we get people to pay attention to this problem? Because there's so much rich data and we love talking about AI in healthcare and, it's going to be great. Well, you know what? We have to get our data in order first. If we don't clean up our house, we're not going to be able to do much with AI.
It's a very complicated problem and there's a lot of stakeholders. What we're seeing now is there's an increase in companies like Evidently that are recognizing this as an industrial scale issue. It's not about not knowing how to do it. It's about how to scale, how to fix data. A lot of people recognize the problem. They try to understand the mechanism instead of understanding the empirical data. And those are workarounds. They don't substitute evidence. What I would like to see is a lot more healthcare systems and pharma and all the stakeholders looking for commercial solutions rather than looking to governments to fund projects.
Yeah. We love saying in healthcare, we've got more pilots than Qantas. Right. We don't need any more pilots. Can we just address these issues, please? That's what clinicians want, and that's what consumers expect.
And it's been stuck in academia as if it's unsolvable for way too long, I think. That can really be done much more efficiently and much more effectively in industry.
Okay. So end of 2022, ChatGPT came along and AI got a whole new focus in everything, including healthcare. However, going back to 2013, you published a BMJ editorial on automating systematic reviews. You basically predicted what generative AI is doing now. Do you feel vindicated by that, or do you think there's more we need to do?
Vindicated is a strong word, I would say. I'd love to tell you that, I saw it all coming. I knew it was coming. Exactly how I imagined it. But no, I was surprised by ChatGPT, I think like everybody else, at how quickly it came. It probably jumped the gun maybe 5 to 15 years, I would say, accelerated the world of AI overnight. And it's not that we didn't have the science for it, but we didn't think the scale worked at the time. We knew about Google Alpha, which was quite promising. We could see in conferences what's coming, but we didn't think it was available for high-level production to consumer level. And that what's really surprised everyone. And we're going through our usual Gartner hype curve. The paper I wrote, the first sentence actually mentions a 1956 book that predicted also that everything will be automated and what will be the impact on humanity. So knowing that AI will come has been romanticized and it's been known for a long time. And I can't say we're finally at the point that we can see it happening. I think we've maybe jumped or turned a corner, but we've been here on this journey all along, and it's just another increment. A big one, but just another increment.
George and I published a couple of very popular PulsePod episodes early in the year on Gen AI in healthcare and those announcements that OpenAI and Anthropic came out with in January. So what are your thoughts on what Gen AI is going to mean for healthcare?
I think what we're seeing is that the ambient AI that collects its own data and then can analyze it is probably more promising than using AI just on raw data. Of course, evidently, what we do is we make the data available so AI can use it. But I think without this step, we're going to be still dredging water, trying to advance where rubbish in, rubbish out rules the day and things are not reproducible. And that approach of just we'll stick ChatGPT on top of our data and see what happens. That is not going
What's the worst that can happen, Guy?
We see that and people still do that and they can get funding for that, but it's really doesn't yield anything. We don't see it changing practice. Whereas ambient AI, we do.
And by ambient, do you mean the AI that's listening, like the scribe?
Yeah, the scribes. This seems to be where the effect seems to be higher. Another area is more on the administration of healthcare or healthcare systems, improvement and streamlining things like payment processes. These are less attention grabbing and maybe patients don't care about them so much, but they have just as much effect as research on, say, new cures has on disease.
So look, that's been a great discussion, Guy. We've covered lots of areas.
Guy, thank you so much for coming onto the PulsePod studio. It's been great having you here, and I really look forward maybe offline to finding out what this secret stealth 11th company is that you're starting.
Okay, thank you.
Thank you, Guy.
Thank you for listening to Pulse, brought to you by Pulse IT News. Pulse is produced by myself, with audio engineering by Ivan Jurek of Octopod Productions. Thanks to Emily Mara, co-founder and publisher of Pulse IT News, for all of her support. And big thanks to all the Pulse Poddies, to everyone for listening. And please make sure you subscribe, follow and rate us wherever you get your podcasts. And don't forget, you can visit pulseit.news to sign up for the e-newsletter and explore Pulse IT's massive digital archive. If you'd like, please send any feedback or topic suggestions to pulsepod@pulseit.news. George and I always love to hear from you. Bye.